Hi, and welcome to Coping During the COVID Crisis. I'm Janet Gross. Besides the devastating health and human toll, one of the many ways this virus is shaking our world, of course, is economically. For many, this is a really tough financial time. Personally, some have been able to work and get a paycheck, but some people, they just don't have a job anymore. Laid off, furloughed, whatever you want to call it, no income. And those, savings for the future, retirement, pension funds really hit hard. It can be so stressful and draining, not only to our bank accounts, but mentally. Dr. Roy Salgado, who's professor of counseling at the University of Holy Cross, is here to talk about those issues, what you can do, and what they might be able to do to help you. Thanks for joining us.
It's good to be here.
These are real, serious, frightening issues. There's so many issues surrounding this one thing.
Right.
Because it all kind of filters down into many, many things, depression and fear and all those things.
Right. Not only do we have to worry about the infection itself, the virus, but on top of that, 2 months into it, here we are having to worry about our economic state. Many people are in a different situation today than they were 2 months ago. They're fearful, they're anxious, many of them don't know where their next meal is going to come from, and that produces a lot of anxiety and a lot of fear in people. And then that leads to a number of other problems, familial problems, interpersonal dynamics. We're seeing people who are impacted by this in experiencing depression, anxiety, alcoholism, substance abuse, domestic violence, child abuse. There's so many different things that are secondary consequences to economic problems and job loss.
So I mentioned it at the beginning of the show, what is the University of Holy Cross doing? I know that there is a special service that you are offering for free.
Yes.
Tell us about that.
Well, we've been doing telebehavioral health for 2 months now, and it's been going quite well. In addition to the types of counseling that our counselors in training can offer to the community, is that of career counseling. It's an unusual time with regard to job loss and economic stress, and there are certain skill sets that our counselors have in being able to offer some insight as to what some possible next steps could be, to have a fresh set of eyes of people looking at a person's situation. Sometimes people, when they're in a dire straits and they're in economic uncertainty, they don't know what to do next. Talking about it with someone with a clear, level head who's able to process what's going on, to offer some insight as to what a next step could be. Sometimes we're not aware of our strengths. We have strengths that are there, and even though we might be unemployed and we are limited in resources, to think outside of the box and to have a professional be able to see what those strengths are and see what a new possibility for income or restructuring your life could look like.
And you mentioned professionals. These are students at the University of Holy Cross. For the most part, there are supervisors and their teachers and advisors and everything working alongside them. But these are people who are trained in this, and they have gone through all the required courses, and this is something that they are doing. They even have special training perhaps in some of these certain issues like unemployment.
Yes, people think of mental health counseling as something to do with anxiety and depression only. But those who are prepared as licensed professional counselors who are working towards that particular licensure also are prepared with career issues. Our profession began over 100 years ago specifically dealing with vocational and career training issues with the military and with high schools and things of that nature. And so those skill sets are still there, having people be able to identify their strengths, what their interests are, to assess their current situation, to determine what their achievement levels are, their aptitude levels, and see what's possible in the current situation. Maybe you're not doing what you had been doing 2 months ago, but you still have skill sets and strengths and things to offer the community that perhaps the new economy has available to you, and you're just simply not aware of it. And talking about it with a professional might give you some new insight and new ideas as to how to proceed.
Because 2 months of isolation, of fear, and all those things can really, dull your hopes and your ability to think about, well, I am okay, I can do this. I can, it kind of pounds you down a little bit.
Yeah, for 2 months, when you're there and you're feeling anxious and fearful and depressed, you're not necessarily able to think about the positives. Yeah. You're not necessarily able to think about what your attributes are that you can offer in other capacities. And so having someone listen to your situation and assess who you are and what your interests are and what your abilities are and what your strengths are can kind of remind you, you know what, yes, that's true. I do have this, and I can offer work and make a living for myself in new ways, if nothing else, temporarily.
Mm. You know, we were talking about the feelings that come up because you see, if you don't have a job, you see people who are working from home, complaining about working from home.
Right.
You see people who actually go out and work, and they're complaining about having to go out and work. And those people are complaining about the people who get to work from home. You know, it's all this weird dynamic.
It's fascinating to see that you have these different types of groups, you know, that you know, those that are able to work from home and they're able to pay their bills and feed their families, and those who go out to work and are able to pay their bills and feed their families. And then there's that other group that is just not working.
Yeah.
And that the income stream has stopped dead in its tracks, and they don't know where the next paycheck is going to come from. And the counselors in training at the University of Holy Cross can offer additional help to those individuals to help guide them through this, to help them think about their situation in a new way, perhaps, that can offer them hope.
And I guess us as just humans, we should always consider the other situation too, because we can be complaining about something and then think, oh gosh, you know.
Even those who are in the most dire of straits economically with job loss and economic stress can find the positives in their situation. Perhaps they can't see it immediately because they are stressed and fearful, but through counseling, someone might be able to help them figure out, you know what, there are certain things that are positive. Nothing is 100%, nothing is absolute, nothing is all negative or all positive. There's a little bit of both. It's that whole yin-yang philosophy that even in the dark times, that there's some positives as well that we can focus on.
Right, and through this service that the University of Holy Cross is offering, you can get that for free. We have a number that we're putting up throughout the show so that you know what you can call, and you can set up appointments. It's all telemental.
Yes, it's all through telebehavioral health, telemental health, and it's completely free of charge. And our counselors in training are completely trained in how to be able to offer this type of service. Our faculty has been training them for years in how to be able to provide this type of service to the community.
And it has been going on just for a cost, but now it's free.
Yes. Yes.
Okay. All right, well, we're going to come back and we talk more about this issue and many others right after this.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
And welcome back to Coping During the COVID Crisis. We're going to bring in an expert, someone from the University of Holy Cross, a colleague of yours, Dr. Salgado, Dr. Ted Remley. He's professor of counseling at the University of Holy Cross. Thanks for joining us.
I'm happy to be here with you this morning.
You know, we've been talking a lot about losing jobs and losing income and maybe even losing self-esteem. So many things go along with the lack of employment. So people have lost their paychecks. They have lost their place to go or place to be a part of a workforce. How can the counselors at the University of Holy Cross help?
Well, I think one of the really good things about counseling, is distinguished from the other mental health professions, is it's for everyone. Everybody can benefit. The whole idea of counseling is to help people live their lives to the fullest potential. And of course, for us in the United States, work is one of those things we have to do in order to be happy and productive citizens. And counselors are very skilled at, we have courses in helping people select careers, find jobs. It's a part of daily decision making. And counselors are skilled at helping people identify what they need, set a goal, begin working toward that goal. And so it fits very well with the counseling process, helping people with work-related issues.
Is it often hard to convince people that this isn't their fault, that this isn't something that they really had any control over?
Well, I think that's usually how people feel whenever they're distressed. Is they feel guilt, they feel maybe they did something wrong, and that's part of the counseling process. Is helping people build their self-esteem, understand that the main thing is to recognize the problem and figure out how to resolve it, and try to move away from issues like that. And that's what counselors help people do. Is tackle the problem rather than wallow around in this self-guilt or the stress that they feel.
You know, I know that you're an educator, you're a supervisor. How do you make sure that these, there are still students, these counselors in training are ready to give this kind of advice, to talk to people, and how do you ensure that they know what they're talking about?
Well, anyone who talks to a counselor at the University of Holy Cross can rest assured that they're receiving high quality services. This is a particularly good question for me. I've been on licensure boards in 4 different states. I'm a lawyer. I understand how the concerns that might be about having quality. All of our students have finished their programs. They're at the end. Just like any other profession, there's an internship at the end. So the students are in their internship, just as if you go to a hospital, you might see a physician who's an intern. And a person who is at that place in their education is highly skilled. Like I said, they finished their program, and now not only are they delivering counseling services, but they're being monitored very closely by professionals who are licensed, and they consult with them. We watch what they do. We make sure that they're performing their services adequately, and if there are any problems, we jump in and help them resolve them. So I think anybody who comes to our Center for Counseling Services can be assured that they will be high quality.
Okay. So after, I guess this will not end certainly for people who are out of work once the stay-at-home orders expire, or once we kind of get back to some sort of normal, because they still have to find a job, and that may, who knows how long that might take, and it's got to be disconcerting, and it can be disillusioning, all those things, as they don't find a job as the weeks go on after this.
Well, again, that's where I think we're going to be able to be very helpful. Finding mental health services is difficult, particularly when you don't have health insurance. And so I think our center is going to continue to function. In the past, we've charged very little. Now we're charging nothing at this particular time, but in the future we'll be available. And it's a place where people can go. I think turning to a counselor when you're struggling trying to find a job is very important to have a counselor available, and we can be helpful in setting goals and moving through the process.
I would also say that, the counselors in training at the University of Holy Cross, they're very well trained in identifying where people are individually. Everyone's case is different. No 2 situations are alike. And so they assess where the client is, they meet them where they are, and then they go from there to determine a plan, to implement a plan in terms of what to do next, in terms of applying for a job, looking for work, seeing where their strengths are. And all of these things are things that counselors are very apt at being able to do with individuals.
Okay. Well, Dr. Remley, thank you so much for joining us and helping us talk through some of this. We're going to take a break, and when we come back, we'll be talking more about this particular situation and talk with another one of your colleagues. Stay with us.
The Willwoods community prays for the safety of healthcare workers, and we thank them all for their dedication and service during this COVID-19 pandemic.
To those on the front lines in hospitals, clinics, nursing homes, and testing centers, we thank you. We thank you for answering the call. The stakes are high and the challenges innumerable, with harsh conditions and no second chances. Yet our doctors, nurses, technicians, transporters, EMTs, pharmacists, and everyone who supports patient care are rising to the occasion, healing and caring for the most vulnerable in our community. You are our heroes. Thank you for the sacrifices you make every day, and especially during this pandemic. Your dedication, commitment, and courage deserve our deepest gratitude and admiration. It's with your help we will all get through this.
And welcome back. We are talking about some of the issues that come up with joblessness in this kind of situation during the pandemic, and how people are suffering, and how in many different ways, maybe with income and just the social aspects of it. But we are going to bring in from the University of Holy Cross, Dr. Ryan White. He's director of the Thomas E. Chambers Counseling Center at the University of Holy Cross. Thanks for joining us.
Thank you for having me.
You know, we have been talking throughout the show about some of the issues that come up because of joblessness or a loss of employment. Can you tell us what the biggest issue you're hearing from some of the people you're talking to on the telemental call lines?
Certainly. Uncertainty, loss of normalcy, loss of routine, loss of stability, not being sure when this is going to end, not being sure when they're going to be able to go back to the things they want to do, whether that's work or social life or family.
And I guess they really don't see an end to it, even if there are decisions that free up other people. That may not be an end for them, certainly.
I think early on, a lot of people thought that this was only going to last a few weeks, and now as it's starting to stretch into an uncertain time frame, yes, people are worried that they don't know when they're going to be able to go back to their normal lives.
How do you encourage someone, the counselors in training, how do they encourage someone when there is so much uncertainty?
Finding a new normal, if possible, adapting to the circumstances, being able to roll with the changes in order to outlast them.
So that seems like common advice. Do you think it's something that people just need to hear all the time?
I would say so. You know, human beings are resilient. You know, we've been able to overcome so many different things, you know, in the human experience, whether it's war, whether it's pandemic, whether it's economic depression. People overcome these things, and individuals have their strengths. You know, we all have things that we can contribute, and the counselor in training can point that out, can in their questioning, and they're getting to know the client, the individual, they're able to assess who that individual is and be able to pick out those strengths and point it out to that individual, and, you know, build up their self-esteem and say, you know what, even in these circumstances, yes, I lost this particular job, yes, I lost this business, yes, I do not know where the next paycheck is going to come from, but I do have strengths, I do have attributes, I am resilient, and I'll be able to find a way through this, perhaps with the support and help of a professional. But the possibility of finding a new normal, a new hope is there.
Mm-hmm. Because, I mean, we are facing at this point, obviously, record unemployment, historically low, high unemployment rates, something we haven't seen since the Great Depression.
Right.
And just instead of like over a couple of years, as that was, over 2 months. And I guess, Dr. White, as your counselors are talking to people, this is new for everyone.
As you said, it's unprecedented. It's historic. None of us are sure yet how exactly this is going to play out. All that we can do is try to continue adapting as best we can as circumstances change.
Is counseling with people dealing with economic stress, is that different? Is there a different approach, really, a different way of kind of coming on, you know, to talk to people than just with things like depression or anxiety?
Surface level, there's a lot of overlap, again, because of the uncertainty and the damage that unemployment or financial distress can do to self-esteem or volition. But The main difference from our perspective, from the clinical perspective, is the different skill set required for addressing these issues. So our students in the career counseling class are trained to do the kind of assessment, appraisal of aptitude, appraisal of interest, in order to help clients not only find the best occupation for them that they can acquire in these circumstances, but also the best pathway for them specifically with their own background, with their own interest, with their own strengths and resources for making it there.
So as you look forward, as we all look forward to a time when this is no longer, when everybody is not the same really, in their houses, in places where, you are stay at home and safe at home, what issues do you see coming out of this for people who are unemployed, can't get a job, can't find a place to fit in again in their normal lives? This can lead to some serious issues that, as you were talking, Dr. White, will continue to need counseling. But people are going to be facing this being at home when they don't need to be home.
Right. And anecdotally, we in the New Orleans area are familiar with this. We've gone through this before. We've experienced Katrina, and we've experienced the aftermath, of such a disaster, of not having an income coming in regularly in the way that we had known before. I myself, I recall during Katrina when I lost my job, a professor at that time, Xavier University, and then we were in Texas for an extended period of time, and the income was gone. It stopped, but we still had to pay the hotel room where we were in. So what did we do? I cut grass, and so people are resilient. You do what you have to do when you have to do it. And so I'm confident that people will be able to do what they need to do in the short term to be able to meet their goals, to get to their long-term goals once things start to return to some sense of a normalcy. And if not normal, a new type of security, an adjustment to their experience. I counsel a number of people from Latin America, and they've come from a number of different difficult circumstances. Perhaps people who had certain lifestyles, who were well-to-do, but then here they had to reinvent themselves, and because they had nothing. And they've been able to do it successfully. That's the immigrant experience. And so I think that people here as well can reinvent themselves in this new situation. And I'm confident that with the proper guidance, the proper counseling, the proper help and perspective, that people will be able to tap into that sense of resilience and be able to overcome this pandemic.
So you might not be on the same path, but you might be on a different path that might be okay.
Yeah.
What happens if you do get a job, and this is really for people who go back to work as well. You get a job and you suddenly get sick or you start to feel bad. You're going to have, I think it's probably human nature to maybe hide that a little bit, and then you might run the risk of having people go back to work too early. Is that something that, do we all harbor that in our heads, kind of a self-protection thing?
I wonder if employers are going to have to reassess how to handle situations like that. To permit people to work from home when they develop symptoms of whatever type of infectious disease, to create the conditions where people can still remain employed if they were to be sick, work from home, work differently at their job site, whatever that may be. But I think we're all having to think outside of the box and re-examine how we operate from this day forward.
Dr. White, do you see some sort of a prediction of the not the need for counseling, but what kind of issues are we going to face as a whole community, as people do get back to work, people don't get back to work? It's obviously a different world, and I'm sure that counselors have to educate themselves as they try to help others.
Well, earlier, the expression that was used was reinventing yourself, and I think a lot of people are going to have to reinvent themselves to adapt to these circumstances. And I don't think that's going to end when the period of everyone staying at home ends. I think that there are going to be ripple effects, that there are going to be societal changes resulting from this in the workforce, in how people do their jobs, that we're all going to have to continue to educate ourselves about so that we can help our clients as these changes occur.
So as you go forward, I guess, and people reinvent themselves and we all face something that's strange and new, is there any event or are there things that you can look back on as counselors, as advisors, to convince people that, okay, it's going to be a new world, here we go?
I think it is similar to other catastrophes that this city has weathered in the past, like Katrina. I think that those events in our history are our main reference point, our main resource for how we've gone and persevered through these kinds of trials before, and what lessons we can learn from them and apply to this new trial.
Dr. Remley, thank you so much for joining us. And I know, Roy, we've got a minute left, but I want to just, if you could give us some tips on things that we can keep in mind as we go through the rest of this week, the rest of this month, whatever.
Yeah, I think it's important for us to realize that we need to assess our current situation. First of all, can regroup and say, where are we with regard to our job situation, with regard to our finances? So that's a key thing. You have to know where you are in order to be able to know where you're going. And think practically. So perhaps this is not the plan that you had set out for yourself, but it's important to think practically in terms of what the next step would be. If you need to look for temporary work or income, perhaps do that just to pay the bills, get food on the table, and feed your family. Keep to a schedule. Routine is very important for our own mental well-being, and don't stop having fun. Just because the bottom has fallen out in many respects, you still need to enjoy yourself. You still need to have fun, because that's going to keep you keeping on to the next day and be able to be there for yourself and for your family.
Thank you so much, Dr. Salgado, for your colleagues at the University of Holy Cross for joining us and talking through these issues. Thank you for watching. We want to help as we are all coping during the COVID crisis.